Thanks for having me. I'm going to apologize in advance. I have a terrible cold, so I may lose my voice as we go along here. We'll see. But so I'm here to talk about, I'm not going to teach you how to plan a $40,000 treatment plan in your office. I'm going to teach you how to save like $10,000 and $20,000 in liability or legal costs by picking the right patients and making sure that the cases are ones that you can complete at your skill level. I like this because this is really true. Any patient that walks into our office is new and unique, and so every time we have a new patient, we are kind of guessing at what we're going to be doing for that patient. I call this the art of triage, so picking who are the right candidates for these kinds of cases. And all of these factors are important, so the patient's personality and their expectations, their medical history, and of course, a good clinical examination. And frequently, we skimp on all three of these areas, which really should be probably the most important part before we begin any of these treatment plans. Whoops. So let's say these two patients walk into your office. Let's just see a show of hands. Who thinks that the patient on this side of the screen is a nightmare? No. Okay. Couple people. How about this? People think this is a challenging case? No? Yes? Maybe? Okay. So, these are two completely different patients with different needs. Some of you might find that the patient on the left-hand side is going to be challenging to restore aesthetically. Some of you might find this patient on the other side of the screen. So it's important to know where your comfort levels lie. So you want to ask the right questions. Does this patient, either of these, do they want to improve their function? Do they just want to eat again? Do they want to be pain-free? Or are their desires more subjective, like I want a perfect smile or I want perfectly straight right teeth? If both of these patients came into my office and they said, I want to look like this, with both of these, I'd start getting hives, because this is probably unattainable for both of these patients, or close to unattainable. Okay, and that's what you have to remember. So you want to base the patient's expectations and their clinical presentation on your treatment plan. So is what they want and what you see attainable, and how do we identify cases that we need to avoid? I just threw in this slide, Dr. Gabriel touched upon this, but in terms of missing teeth, these are US statistics, but the majority of patients who are missing teeth actually fall below the poverty line. And so you have to keep that in mind, because these treatment plans they're expensive, and some of them, may not be an option for certain patients. So keep that in mind. Let's talk about a few tips that I like to watch out for. Probably most of you know these things, but we forget. And a patient walks in our office and we get excited about doing a treatment plan, and we take that patient on, and we've all done it, and then we're sitting there kicking ourselves later on because this patient has become our worst nightmare. So when we've got these huge treatment plans, you want to avoid that. So number one, negotiation of fees. So these are complex cases. They require excessive preoperative planning, a lot of postoperative care, and so the fees that you charge should really be reflective of that, and they should be non-negotiable. And so if patients are coming in and they want a quick, cheap fix, then probably they're not going to be a good candidate for a full mouth rehab. Unrealistic expectations about aesthetics. We can't change Mother Nature. So if patients want to come in and they want to look like Jennifer Lawrence and we can't do it, we need to be honest with them and ourselves about that. You want to be careful of patients that come in with a history of multiple appointments at different specialists, different dentists, the kind, they come in with their file folder, they have 10 different treatment plans in there, and they're throwing them at you and saying, can you do something better? You want to avoid these patients because they're looking for the answer that they want, which probably is not what anyone would do, or they're looking for a price that probably you're not going to do as well, okay? This is an important one too. We all know these patients. They're coming in and they're saying, oh, I had this bridge done and it never fit right, and